My name is Ronnie Dangerfield, and I'm here to talk to you about delegation. Delegation is commonly thought of as the shifting of authority and responsibility for specific functions, tasks, or decisions from one person to another, usually from a leader or manager to another person. Delegation is not pushing off your responsibility, it is about spreading out assignments in a way that best fits everyone and advances the organization. 5 rights of delegation: right task, right circumstance, right person, right supervision, right direction, and communication. Right task: delegating the right task to delegate are repetitive, require little supervision, are non-evasive, and have minimal risk. The right circumstance includes the appropriate patient setting and available resources. The right person: delegating the task to the appropriate person means that you should make sure that the assignment given is within the person's scope of practice. Right supervision: provide supervision, evaluation, and intervention as needed. Right direction and communication: give a clear description of the task, including expectations. The communication should be ongoing. Who can delegate to who? An RN can delegate up or down. For example, if an RN is delegating up, they can ask a doctor for a diagnosis so they can provide care for the patient. Or, if the charge nurse encounters a situation that she needs further help with, she can ask the nurse manager to intervene. This is delegating up. An RN can also delegate to an LPN. For example, if the RN is busy doing an admission, she can delegate passing meds to an LPN. An RN can also delegate to a CNA or NA. Things such as feeding, changing, bathing, blood sugar checks can be delegated to a CNA. Delegating to an RN should be easy because it's things that are already in your scope of practice. What can be delegated? Delegating to another RN should be easy because it's the same things that you can already do as an RN. RN to LPN. Delegating to an LPN, things such as administering medications that are not high risk, administering an NG tube, perform wound dressings, monitor blood products, trach care, suctioning, NG tube checks, and administering internal feedings. RN to CNA. Treating patients, giving bed baths, and helping patients ambulate are all things that can be delegated to a CNA. What not to delegate. The licensed nurse cannot delegate any activity that requires advanced education, clinical reasoning, nursing judgment, or critical decision-making. Giving medications, blood transfusions, NG tube feedings, inserting IVs, or admitting patients are all within the RN scope of practice and cannot be delegated to an LPN or a CNA.